Good evening. How you doing? My name is Dennis Ayers. I want to thank each and every one of you for joining me again today. This week we have been talking about health care, uninsured health care and the cost of it. We've also talked about insured health care. We compared the two that shows that on average, a person that has health care, if they are managing a chronic condition, on average, their out-of-pocket costs on average is about $4,800 a year, and that includes medicines, doctor visits, and time. It equals out to about right up under $5,000, and that's with health care. And those includes deductibles, co-pays, now those without insurance, managing that same chronic condition, you're up anywhere from $1,500 to about $2,000 more annually. So, there are plenty of opportunities for someone who is working, whose company that they're working for does not offer insurance. And we need to be clear about that. If they offer insurance and you think it's too high, then you are obligated to go with that insurance. If you're paying that $100 a month for health care, and you think that's too high, I'll be honest with you, that's pretty cheap. And by according to the rules of healthcare.gov, then you have an obligation to go with that group coverage and not go with the ACA, or what they call the Obamacare. So we're going to talk about that a little bit. We're also going to dive into just a little bit, and we're going to go in knee-deep water, about the current situation with Blue Cross Blue Shield and the University of Mississippi. Because for some people here in the state, that is, as of July 1st, that has become a real big issue. But the silver lining in that is, if you are doing things at the university, you may be able to get your money back if you've paid anything out of pocket concerning a doctor visit starting after January 1st. So let's finish up with what we were doing. This week we talked about the growing concern. It's growing deeper and deeper, but what it is the recidivism and the percent of recidivism, how it correlates to being a public health crisis. We're not there yet, but as our population, as our prison population grows older, as they are being released, and if they are or have chronic conditions that they have to deal with, when they leave prison, they're on their own for the most part. Now, if you're over 65 and you have worked a certain amount of time before getting locked up, then you may reapply for Medicare or apply for Medicare, and that will take care of your health care needs for the most part. But still, we'll talk about that another time, how Medicare works. That'll be for another segment. But there are some things that those individuals can do, and other factors included in healthcare when you are released that will contribute to recidivism. We talked about the health component, but also the lack of education and or training component. And we have to take a look at poverty. Interesting study by Prison Policy Initiative. And they did a report, and they put out some. I'm just going to read some stats on what happens. What we talked about yesterday, over 67% of anyone getting out of jail will be rearrested within 3 years, and over 76% within 5. So that in itself is an issue, and that's telling us that there are some things that needs to be addressed. The average age of people that are on probation is in between 18 and 20 years old for the first time. Unemployment rate for those that have been re-released is up to 27%. So we know that there is a disconnect. Sometimes it's an employer, but a lot of times you will find those employers that are willing to give you a chance, but you have to meet those qualifications. And when people think about this, when you're out of prison, you don't think about if you do have a job, how do you get there? What's the job pay? Is it worth it? I mean, there's so much to go that you have to consider when you are newly released. 25% of anyone incarcerated will be released without a high school diploma or GED, college degree, or anything along that line. 25%. And considering that, you have to understand that there's a lot of things embedded in that that we don't think about. Such, for example, reading comprehension. How much do you understand? Can you read? And an employer, in most cases, if they're going to hire you, especially dealing with heavy construction or anything that may harm you, is they simply want to know, can you read and comprehend the instructions concerning that equipment? Homelessness. Interesting study. Over 5,000 people per 100 newly released are homeless. Over 5,500 people per 100 that have been released will be homeless, and that may be lack of family structure and support. That may be lack of unaddressed substance abuse. It's a number of things, but that number is extremely high for homeless. And here is something that I didn't think about. That's just heartbreaking. Is one of the largest contributors for, or strongest factors for, recidivism or re-arrest is poverty. That is a powerful statement. So in some cases, you're being penalized for being poor. The numbers can be stacked against you, but help is out there. It's just a matter of you finding it. So if you are released and you do have a job, we're going to talk about some things that will help you. And the ACA is one of those things that will help you. Now, what we want to do is we want to talk about that a little bit more. You can give us a call here at the station at 800-492-5186. That is 1-800-492-5186. You can also view this message on Facebook, We Believe Digital Facebook page, or you can go to webelievedigital.com, and that is the platform for this podcast. Or you can go to YouTube, and We Believe YouTube podcast. And you can go to those places, and you can pull this up really anytime. I tend to draw all of my information as accurately as possible from either government research sites or the federal government itself through those departments such as Department of Justice, anything along that line. But you can also reach me at, you can go to my website, and that's DennisAyers.org, or you can just simply contact me, and my company phone number is 601-209-9853. That's 601-209-9853. So check us out. We are here. We're not going anywhere, and we just simply want to get information out. We want this program to be a wealth of information. Now, for those that are working, there is help for health insurance if you desire it. There's certain criteria that you're going to have to meet, and one of those criteria is great help if you are considered anyone under that federal poverty level that the federal government sets forth at 138%. So if you and most people that have heard about Obamacare or the ACA, when that first came out, there was a lot of information pumped out there because the government, quite frankly, wanted you to have some type of insurance. Well, that's happened in quite a few states, except the state of Mississippi has not expanded Medicaid. So here we are extremely limited. There are 4 or 5 companies here, depending on where you live, that do offer service. And if you are right at that poverty level or that fit under that poverty level criteria, there is some pretty good help for you because what they do with the government, they look at that and they may offer you a subsidy, or you may qualify for a subsidy. And simply what that means is they will assist you in paying your monthly premium for your health insurance. The health insurance is great insurance. It's going to provide you with your doctors, your hospitals, any type of service that you may need, and also your medicine. And those are some of the things that I think that most people just don't believe that are out there, but they're there. It's not very much advertisement concerning ACA for whatever reason. Open enrollment. And most people right now, if you do not have insurance and you believe you qualify, you will have to qualify for what they call a special election period to allow you to go over that. And it's 13 of them, or 13 of them, but we'll go over exactly what those are. You can call healthcare.gov, and we'll be glad to give you that number. As a matter of fact, I'll give it to you right now. It's 1-800-318-2596, and that is healthcare.gov at 1-800-318-2596. And if you, for whatever reason, think that you qualify or you've want to try insurance and you think you may qualify. And as I go over this list, we'll see, you can see if you may qualify, and you can call healthcare.gov, or you can call Ayers Insurance Group. We can answer those questions for you at no obligation to you whatsoever. And you can, we'll find out. We can give you a quote. You can go to my website, and there's a quoting tool on there, and you can give yourself a quote at Ayers, DennisAyers.org. But we're going to take a quick break, and when we come back, we will talk about ACA and those special election periods. But give us a call right now. If you want to get and join in on this conversation, you want to ask any questions, you can call us here at the station at 800-492-5186. That's 1-800-492-5186. 5186. You can also view us on Facebook. You can view this message on WeBelieveDigital.com. We'll be right back. Thank you very much.
SocratesGarrettENT.com is a diversified firm specializing in recycled aggregates and crushed concrete. SocratesGarrettENT.com's recycled materials provide the construction industry with significant economic and environmental benefits by recycling clean concrete rubble into M.Dot grade rock materials. Recycled aggregates and crushed concrete can be applied to driveways, road construction, bank protection, parking lots, general bulk fills, and more. For more information, please call 601-896-0084 or visit us online at SocratesGarrettENT.com.
Advertise on WeBelieve.global, a brand new digital media platform. Share your brand with our audience on our many global live stream TV broadcasts and over the radio. For more info, visit WeBelieve.global or call 800-492-5186, option 1.
Okay. All right. So today we're talking about insurance and how you can gain it through the ACA. There are a couple of what we call the special election periods that will allow you to get insurance outside of normal open enrollment periods. As of 2020, when 2021 came around, insurance open enrollment starts on November 1st. That is November 1st of each year, and generally it goes until December 15th. So there's a 45-day window that you have to get insurance. If you have Obamacare and you like it, really there's nothing that you have to do. They will send you some information in the mail asking you if you want, does anything changed? And if you gained an increase in employment, you simply have to notify them and let them know that so they can make those adjustments. If not, then those adjustments will be made when you file your income taxes. And that hurts. So give us a call. Let's talk about this. We got another 14 minutes. And you can reach us here at 1-800-492-5186. That is 1-800-492-5186. Once again, my name is Dennis Ayers, and I am the host here at Health and Habits. And we are also on Thursdays. We have a Health and Habit talk show on Thursday nights at 90.1 WMPR on Thursdays from 5:30 to 6. Interactive talk call-in show. Give us a call. We'll be able to answer any of those questions that you may have. And if we can't answer it then, we'll find that answer for you. Okay, now getting back to ACA. These are 12 qualifying events that may trigger a special enrollment period. And one is loss of voluntary coverage. So, for example, involuntary loss. So, in other words, if you had a job and for whatever reason there was a layoff and you lost your health insurance, that opens up a window for you to get health insurance for the next 63 days after that event has happened. So you qualify for that open enrollment period. Even if you are receiving unemployment checks and that's your means of income, you can still apply for that. Apply for the ACA or through healthcare.gov. Individual plans renewing outside the regular enrollment period. So if that involuntary loss happened in August, November you could change, or if you stayed around and that calendar year came, then that may create an open enrollment and a special election period for you. Becoming independent or gaining dependent. So in other words, what that means, if you are out of the house and you are working and you're 21 and you've just stepped out on your own, or you've gained your dependents, and that includes those that are returning citizens. That includes you, because now you're gaining your independence again. So you have the opportunity, if you have been newly released and you are blessed with a job, if that job basically pays you, and you're a single man or a single woman, and that job basically pays you somewhere around $1,400 a month, and your job does not offer health insurance, there's a wonderful opportunity for you to get health insurance, especially if you already have chronic conditions and you need help. There's help out there, and there's a way to get it. Give us a call at Ayers Insurance Group, and that's at 601-209-9853, and we'll be glad to give you a quote. We don't have to sell you anything, but we want to get you on the right path so you can have a healthier you. The other one is marriage. The other one is divorce. So if you are married and your spouse, you and your spouse get a divorce, and the spouse was the primary cover of your insurance, and for whatever reason you're not carried, that opens up a special election period for you, and you at this point can get health insurance. Becoming a U.S. citizen, a permanent move. So in other words, if you have lived in Alabama and for whatever reason you move here to Mississippi and to take a job that may not offer insurance, or you moved here with your lady friend and or guy friend, and you are working and you are showing proof of income, then you too qualify for that special election period. These plans are not national plans. These are regional or geographical plans where if you move to a different area, you have to see, for one, is your insurance going to cover you? And for two, is there a plan in the area that's going to fit your needs? So, but it's also wise that if you move and you get one of these plans, one of the smartest things that you can do before you get anything is do your research on your providers. If there's certain medications, do not assume that all medications will be covered by all plans, because they're not. Each plan has a separate formulary, and that formulary may not be different or may be different from the next guy. So those are very important things. What good is something if you can't use it or it doesn't fit your needs? So keep that in mind. An error or problem with enrollment. So in other words, if the computer site or the government website has a glitch and for whatever reason they didn't enroll you, that special election period bounces back to you. Employer-sponsored plans become unaffordable or stops providing minimal value. So in other words, if your insurance, you are paying $100 a month with your group, and that thing jumps up to $400 a month, that is something that's deemed or possibly deemed unaffordable to you. And, I think that there's going to be certain parameters you're going to have to meet in order to get off of that higher cost employer plan and get on the ACA plan. But that will be determined by the government. Also, it will be something that will be determined when you sit down with an insurance professional that will help you explore that. Because what happens at this point, you are trying to gain insurance, and all these insurance plans are covered with that annual wellness exam, which we talked about that and the importance of that earlier in the week. Having an income increase that moves you out of the coverage gap. Gain access through individual coverage, through HRA, or just circumstances that make you newly eligible or ineligible for a subsidy. So in other words, if you had a subsidy and you went in and you got a rate increase, and that rate increase bumped your subsidy, you're not paying, you're paying full price. You now have the option to opt out, get private insurance, or go to group coverage. So these are some of the things that people just simply need to know. At some point, there are just various circumstances that will keep people from getting insurance or not getting insurance. Call an insurance professional to help you understand how this stuff works. Now, interesting story about those that have Blue Cross Blue Shield. As you know, as of July 1st, Blue Cross Blue Shield is no longer in the network for the University Medical Center. Now, those that are affected at the University Medical Center, and that includes the Pavilion, that includes some of the other services that the university provides. If that happens and you do not get a doctor and you go after July 1st, you may be responsible for the cost of that bill. Now, there's a way of getting your money back, and you need to know how to do that, and that's simply file a claim, but you need to know how to file that claim. You'll need to contact Blue Cross Blue Shield and request the claim form. You have to make that request, but here's what I would do. I would make that one request, and I'll make a couple of copies in the event that you have to go. Right now, the most practical thing to do is find another provider that is in network. That's easily said, but if you have a relationship with the doctor that you've had for the last 15 or 20 years, and that doctor has done some things to improve the quality of your life, you want to stick with that doctor. So this is a way that you can stick with them. You'll have to pay up front, but you can do that reimbursement, do that claim form for Blue Cross Blue Shield to reimburse you for that money back. Now here's one interesting thing. Mike Cheney of the Department of Insurance here in the state of Mississippi indicated that they're investigating to see if Blue Cross Blue Shield is breaking a statute here in the state of Mississippi. State law requires insurers to provide reasonable access to all types of care in the insurance coverage plan. The concern is without University Medical Center in its network, Blue Cross Blue Shield may not be meeting this requirement due to the numerous specialties that particular hospital offers. So in other words, there are a lot of things that University Medical Center is doing that no one else is doing in this state, such as trauma. But even in network or out of network, if you have a traumatic situation, a major accident or something like that, they're going to take you to University Medical Center. And no matter in network or out, that is the only trauma center here in the state that will be covered, or that should be covered. If they tell you that's not covered, then that is bad on them, shame on them. But that is one of those things that some of those things that you just simply need to know. If you do have your Blue Cross Blue Shield and you want to seek another network and you're not sure how, give me a call. We'll just be glad to help assist you find those providers for that condition that's in another network. That's at zero cost to you. We'll be just glad to do it. Or if you want to know more about the ACA, give me a call at Ayers Insurance Group at 601-209-9853. That's 601-209-9853. Well, once again, this is Health and Habits podcast on WeBelieveDigital.com. You can also see this at any time you want at YouTube, Facebook, and Roku TV. So, and WeBelieveDigital.com. I want to thank you once again. If you want to have a healthier outcome and change those habits, thank you, and God bless each and every one of you.
The Mississippi Link is an African-American female-owned newspaper with a trusted voice that is highly respected throughout the city, state, and nation. Our motto, keepers of the knowledge for people who speak the truth, since 1993. Link significantly influences the thoughts, attitudes, and buying decisions of its readers. Call us at 601-368-8481 for your advertising needs. If you would like to receive a newspaper in the mail each week, our annual subscription is only $52 per year. That is only $1 per week for you to stay informed regarding many stories that you can only get in the Mississippi Link. Sign up today at themississippiLink.com and click on Home Delivery.